Bones of the arm. The arm consists of the upper arm and forearm with three primary bones. Humerus, the single bone of the upper arm, extending from the shoulder to the elbow. It has proximal end, includes the head, articulates with the shoulder's glenoid cavity and tubercles for muscle attachment. Shaft, a long, cylindrical body. Distal end. Forms the elbow joint with the radius and ulna, featuring the capitulum for radius and trochlea for ulna. Radius. The lateral thumb side bone of the forearm, running from the elbow to the wrist. It rotates to allow pronation, supination, palm up, palm down movements. Ulna, the medial pinky side bone of the forearm, parallel to the radius. It's larger. The elbow olecranon process forms the elbow's point and stabilizes the forearm. Muscles of the arm. Muscles are divided into the upper arm and forearm, categorized by function and location. They are responsible for movements at the shoulder, elbow, wrist, and hand. Upper arm muscles. Anterior compartment flexors. Biceps brachii, two heads long and short. Flexes the elbow and supinates the forearm. Attaches from the scapula-coracoid process and supraglenoid tubercle to the radius radial tuberosity. Brachialis. Lies beneath the biceps, primary elbow flexor. Originates from the humerus and inserts on the ulna. Coracobrachialis. Flexes and adducts the shoulder. Runs from the scapula-coracoid process to the humerus. Posterior compartment extensor. Triceps brachii, three heads long, lateral, medial. Extends the elbow. Originates from the scapula and humerus, inserting on the ulna's olecranon. Unconeus, small muscle assisting triceps and elbow extension located near the elbow. Forearm muscles. These are numerous and complex, organized into anterior flexors and posterior extensors compartments. Anterior compartment, superficial layer. Includes pronator teres, pronates, forearm, flexor carpi radialis wrist flexion, abduction, palmaris longus wrist flexion, and flexor carpi ulnaris wrist flexion, adduction. Deep layer. Includes flexor digitorum profundus finger flexion, flexor pollicis longus thumb flexion, and pronator quadratus forearm pronation. Posterior compartment, superficial layer. Includes extensor carpi radialis longusi brevis wrist extension, abduction, extensor digitorum finger extension, and extensor carpi ulnaris wrist extension, adduction. Deep layer. Includes supinator forearm supination, abductor pollicis longus thumb abduction, and extensor pollicis longus brevis thumb extension. Ligaments of the arm. Ligaments stabilize joints by connecting bones. Key ligaments are found at the elbow and wrist. Elbow joint, ulnar collateral ligament UCL, medial side. Stabilizes against valgus stress, prevents excessive outward bending. Radial collateral ligament RCL, lateral side. Stabilizes against varus stress, prevents excessive inward bending. Annular ligament.